Hello everybody, I am Dr. Binu Thankappan, a Specialist Cardiologist of Phoenix Hospital. Today, I would like to discuss something about the heart ailments, various heart ailments and disorders. We all know that heart is an important organ in our body and heart disease is very prevalent in our society. Today I will discuss some of the risk factors and symptoms of heart disease and how to make a proper diagnosis for heart disease and how to treat it. Coming to the risk factors, if you take the risk factors, first and foremost is diabetes mellitus. Diabetes mellitus means high blood sugar. As you know that people with the diabetes are, especially if they have a diabetes for lasting for more than 5 to 10 years, it is better to it is likely that these persons can develop heart disease. Next is hypertension. Hypertension, as you know that as the BP goes up, the chance of developing cardiac disease is very high, and also stroke also very high with hypertension. So diagnosing hypertension is very important. So if you have a family history of hypertension, it is better that you come and check your BP immediately. Then next is cholesterol. Cholesterol, as you know that there are two types of cholesterol are there. One is the good cholesterol, another one is a bad cholesterol. Good cholesterol is the one which help us from heart disease. Bad cholesterol is the one which produce heart disease. So it is better that you come and check the level of your good cholesterol as well as bad cholesterol. If bad cholesterol is very high, better you get treatment for the bad cholesterol. Next is smoking. As we all know that many people of our society they do smoke. It is a dangerous practice and it has to be stopped. Even stopping one cigarette carries high risk. So stop smoking is the only solution. Next comes consumption of alcohol. Alcohol, if you take too much, it's very dangerous for the heart. It can produce blood pressure, it can derange the sugar levels, it can produce heart attack. A lot of issues are there with alcohol. Avoid alcohol is most important thing. Next is people who is having a sedentary lifestyle, that means very inactive people. You have to start exercising from today onwards to avoid a heart attack. Every day you better you walk for 30 to 40 minutes or 1 to 3 kilometers in a moderate speed, that is good for the heart. Next comes a family history of heart disease. You can see in a family if your father, mother or brothers or any close relatives having heart disease at an early age, that is less than 50 years, 55 years, it is better that it is likely that you also have the chance of getting a heart disease at an early age. So you have to come and evaluate for the heart disease at this stage. So these are the main risk factors for developing heart disease. So looking at the symptoms of the heart disease, see some people will have chest pain. We call a typical chest pain like some heaviness of the chest, some weight is kept on his chest like that feeling. That will be there. If you have such a feeling, especially when you walk or do climb stairs and all, if you have this issue, it is better come immediately and check for the heart disease. Then breathlessness. Some people may not have chest pain, they will have only breathlessness while walking. When you walk, you are comfortable till now. After some time, for recently, you feel that when you walk, your breathing is becoming more difficult. In such persons, better come and check for the heart disease. Then giddiness, palpitation. Palpitation means the heart is pounding very fast. If it is a situation, you come and check. And then giddiness. If you have a giddiness while you are walking, when you exert, when you run, it's better you come and check for the heart disease. Then in some people, what we found that without all these symptoms also they can have heart disease. So persons with high risk factors for heart disease, it is better come and check for the heart disease. Then another variety is a sudden cardiac death. Some people will fall down suddenly and die. So we don't know that whom will develop this issue, but it is usually seen in those persons who is having a high family history of heart disease or high risk factors, who didn't check for the risk factors like that. So, it is better that anybody who is more than 35 years but come to the hospital and do thorough checkup for all these things. Then comes the diagnosis of the heart disease. How we make a heart disease diagnosis? It is so simple. You can come to the hospital, we can do an ECG, we can do an echocardiogram, we can do a treadmill test, which will tell whether you have a heart disease or not. We can also screen for the various risk factors like sugar, cholesterol, blood pressure, everything like that. And if you have a heart disease, we can do, if you find some problem with these investigations, we have novel modalities of diagnosing the heart ailments, the blocks in the heart. Like this one is a CT coronary angiogram. It is available in our hospital. Here with this CT coronary angiogram, by giving a dye to your blood vessels, we can find out the blood vessels of the heart, so that even a minor block in the heart can be found out by this investigation. The advantage of this investigation is that it is not invasive. That means we are not putting in any tube inside like a conventional angiogram, so that it carries very less risk of any complications or anything like that. So, it is a very simple procedure. It can be completed within 1 hour usually, and only and most of the persons can undergo this test without any problem. So, but the advantage of this investigation, this CT coronary angiogram, is that it can point out even a minor block in the heart, so that we can take appropriate step to prevent any heart disease or high risk factors. You can now come to our hospital for a thorough review of your heart and your well-being of your heart. Thank you.